Survivorship Simplified. I am one of your hosts, Adrienne Menzies, and today we're diving into a topic that deserves way more conversation: men's health and survivorship. Movember, is all about raising awareness for men's health issues like prostate health, testicular cancer, to mental health and prevention. Today, I'm joined by two of our favorite experts who know this topic inside and out, Dr. Joe Mignone and Dr. Todd Robinson. Can you guys introduce yourselves?
Sure. I'm Joe Mignone. I am integrative medicine, medical oncology, and a co-founder here at SurvivorRx.
And I'm Dr. Todd Robinson. I'm a naturopathic doctor, fellow of the American Board of Naturopathic Oncology, and co-formulator at SurvivorRx.
Today, we are breaking down some of the most common and sometimes confusing questions that men have around prostate health, hormones, testosterone, diet, supplements, food, and health screenings. And, as always, this is just going to be a great Q&A session, a real conversation about real health issues. We've talked about food, we've talked about supplements, and we've talked about how they interact specifically with testosterone. And I think this is a good opportunity to talk about the craze, especially with younger men, with testosterone enhancing drugs, basically, and testosterone replacement therapy. What is safe? What's not safe? What, should men really be careful when they're trying to enhance their performance or their strength?
So there are legitimate reasons for testosterone. There are people out there with low testosterone. And then there's the muscle enhancement, mood testosterone out there. And there are legitimate places to get it. And then there's their bros at the gym. So when you go to a legitimate place, they will actually check your testosterone level, check your other labs. Testosterone can cause electrolyte imbalances. They can get baseline PSAs. You tend to have a slight rise in PSA in the beginning, but then go right back to where it should be. And then, some of the big things with young men on testosterone now is infertility. Now, if you go back to the 1920s, they would look at testosterone and say it fed cancer because they put it in cell lines and, the cancer blew up. That's not necessarily the case. Now we think that the prostate has so many receptors for testosterone, and once they're saturated, they're saturated. You can't overdo that receptor. They followed two groups. One, they gave testosterone replacement. One, they did not. Followed them for multiple years, and there was not any increase in prostate cancer with testosterone.
Interesting.
Having taken that data, then they started looking at people that had early stage prostate cancer, PSA 6, 7, whether they got prostatectomy or radiation. As long as they had a stable PSA for 2+ years, they've given them testosterone up until a level of 400 to 500, as high as 600, but no more. And they did not have any increased risk of prostate cancer. They actually, not statistically, but trending towards less prostate cancer.
Wow.
Yeah. So old things change.
Yeah. So the whole, testosterone boosts prostate cancer or feeds prostate cancer, is that like a myth?
So if you have advanced prostate cancer, it can at least initially give it
A boost.
yes, then fuel on the fire. We're researching more and more to find out exactly how much it feeds it, who we should be avoiding it. We use testosterone blockers to treat, and we know that definitely helps. That's why we call them hormone sensitive or hormone resistant prostate cancer. So there is a fine line, there's estrogen involvement in there too, but we're trying to figure out who to avoid, who to give low dose, who will benefit. And, if testosterone replacement's really to help people feel better for the mood, the muscle weakness, the fatigue. You don't want to make someone miserable. We want to find out how much we can improve their quality of life without giving them any increased risk in their cancer progressing.
So I think the real hot question here is taking testosterone boosting, either therapy or drugs truly dangerous, or is the fear that it could feed potential cancer?
What do you mean by danger? We have the cancer danger. So it's been proven not to increase cancer. It's been proven not to increase heart disease.
Okay.
Having said that, I see many people on testosterone that have elevated hemoglobin levels, which can increase risk of strokes and blood clots. We know it's going to lead to more infertility. So there are risks. That's why, knowing what the level you're getting to is extremely important, and having someone follow the electrolytes and follow everything else and follow your symptoms to make sure you're not overdoing it is important.
Interesting.
So let's say you have a 25-year-old patient who is healthy, no problem, putting on muscle in the gym, no nothing, but he tests low normal in his testosterone level. Step away from the testosterone, boys. Seriously.
Yes.
And it's because it will absolutely interfere with your body's ability to produce testosterone on its own over time as you get older. And that's something you don't want, just to, have slightly larger biceps at the beach. So don't do it. That being said, so I'm curious, for men with a history of sort of low-grade prostate cancer, one of the goals from a lifestyle standpoint after treatment for me has always been, okay, let's help these guys get lean. Let's help them put on a little muscle tissue. Let's help them be vibrant and strong again. And supplemental testosterone for some of those guys is really effective towards that goal. And so it sounds like what you're saying now, even from a sort of conventional medical oncology perspective and the cutting edge research, is that can be okay for a portion of those guys.
Mm-hmm.
Right. So the study was on people that were treated. So technically their prostate was treated. Shouldn't be sensitive. We have not studied the watch and wait, but that would be a very interesting study. But if you are going to do it on someone with watch and wait, I would have a low level and I would periodic chest test the PSA to make sure it's not rising.
So I don't mean to grill you on the details of the study, but like treated, how are we talking, like
Radiation or
therapy?
surgery.
Okay, cool.
And they have to have had a stable PSA for at least 2 years.
Okay.
To clarify, we're not saying that testosterone is safe to take. I think you're saying that you need to check with your healthcare provider to
Correct.
see what your PSA levels are, and other testosterone levels.
And remember, in that study, it was treated prostate cancer. It wasn't advanced prostate cancer. It wasn't early stage watch and wait. It was treated with stable PSA for 2 years.
Got it.
I would like to ask a question on this. So if there is a sort of specific group of men who have a personal history of prostate cancer, do you feel, I have an opinion on this, but do you feel that every oncologist would be able to successfully manage, like if this was a person who was really interested in doing like a bioidentical testosterone replacement therapy, low dose monitoring over time, like I wouldn't feel comfortable sending them to just any provider. Is there questions that they can ask, or what should they think about in terms of finding somebody who's like super knowledgeable about hormone replacement therapy in this context?
So some of the national urology societies now have it in their recommendations.
Okay, good.
So knowledge is power. They should pull up those recommendations and discuss it with their physician, because most physicians may not have reviewed the latest recommendations.
Yeah, I mean, honestly, they work. I mean, how many hours do you see patients? You can't be up to date on every single research study that's been published. So,
Yeah.
and that seems like it's so deeply ingrained in medical oncology for a long time. Like there's sort of this anti-hormone, whether it's breast cancer or prostate cancer, sort of like anti-hormone bias that might not be reflective of current knowledge. And so,
Yeah, no, we based it on old data until we had the new one. We were just making an educated guess by what we knew.
so pull up the guidelines, have a respectful conversation with your provider type, and then see how that conversation goes.
I think the other thing that comes along with the testosterone, especially like the gym bro boosting testosterone, male enhancing powders and supplements and hormone replacement therapy, something very important outside of the physical health risks are the mental health risks that are associated with taking too much testosterone. Do either of you want to kind of talk about what that can be?
Well, I mean, I think the key word is too much testosterone.
Yeah.
Too much testosterone can definitely cause some issues. I mean, aggression is sort of a commonly expected or known symptom, although that's probably not as common as we once thought. It depends on the type and the dose. There's actually many different forms of testosterone that you can be taking, whether it's synthetic or bioidentical. So aggression can be one of them, but I would go to the flip side of it. Like for a man who is past a certain age, who really does need a little supplemental testosterone, getting his levels into a safe and normal physiologic range for him can be tremendously beneficial in terms of sleep and anxiety and depression, et cetera, et cetera. A lot of the things that are sort of an epidemic right now for everyone, but men included. Normalizing those levels can actually have a profound impact on their overall mental health.
Yeah, I read a study in Psychology Today not too long ago about men over the age of 50 experiencing severe mood swings, and a lot of it was related to low testosterone.
So just to be the devil advocate here,
Yeah, bring it.
I totally agree. For symptoms, there's a role.
Yeah.
And I definitely think they should go speak to a doctor about it. There's also the anti-aging physicians out there.
Yes.
And they are pumping them with testosterone. I'm seeing them with the high hemoglobins and having to drain blood from them and all that. They need to be monitored. It needs to be someone that knows what they're doing, and not someone just looking for an anti-aging fix to feel like they're 20 again.
Right.
Yeah. So the moral of this story, listeners, is talk to your healthcare provider before you start taking testosterone.
And honestly, the lowest amount that you can take and still achieve your goal in terms of symptoms or lab value, whatever it is, that's what you want.
So, obviously you said that you want to be on the lowest dose of testosterone possible to achieve your goals. What can men do to, either positively affect their testosterone production or negatively, naturally, with, lifestyle factors, diet, exercise, sleep, I'm sure has a factor.
All across the board. Now, I'm sure Joe will have a lot to say about this too, but this is one of the things that I would say, like a hallmark of a responsible provider, a responsible prescriber of testosterone will be that they work through their lifestyle foundations first. They take a very close look at how you are living your life day to day to see if there's something in there that could be interfering with your body's own natural testosterone production. And they're going to work through that before they write a prescription for it.
Right.
So one of the things that I would bring up is sleep. We do know that people who are severely sleep deprived, which is not really all that uncommon these days. It's not uncommon to talk to people who get 3, 4, 5 hours of poor quality sleep at that every night. That will absolutely tank your testosterone levels. Joe, I know you kind of know quite a bit about testosterone and sleep physiology. Like, is that's accurate, right? That
Correct. Most of your testosterone hormones are made while you're sleeping.
Does that apply to women as well?
Correct.
Interesting.
Yeah.
So I didn't
That's why sleep is so important in every aspect of life, whether it's heart disease.
It's called beauty sleep?
Beauty sleep.
Oh my God, my mind just blew. So it really is beauty sleep.
Yeah.
Or handsome sleep for you guys.
Yeah, but other lifestyle foundations are going to be hugely important too. If you're eating a diet that's rich in simple sugars, low in fiber, pro-inflammatory fat, that's not going to help with testosterone production either. Exercise is a big one. You can actually naturally increase your testosterone levels quite a bit by following particular types of exercise. Like we know that strength training will boost testosterone levels, whereas at least temporarily, I believe the research suggests that like really long-term endurance athletes like marathon runners and ultra marathon runners might have lower natural testosterone levels. And so you can pick an exercise program that might boost or downregulate your testosterone production based on your goals and needs.
And just to get back to sleep, I think an important thing we should mention, obstructive sleep apnea.
Oh yeah, of course.
Which interferes with that tremendously. For those who don't know, obstructive sleep apnea is when you're blocking your airway while sleeping. Snoring is a common side effect of that. Waking up, catching your breath is a common side effect of that. I diagnose a lot of it because it also increases your hemoglobin levels as the body tries to compensate for the lack of oxygen. And it's quite common, even if you don't have snoring, you can still have sleep apnea. So talk to your doctor about that as well.
One other thing I really want to bring up in that,
Oh, you're fine.
is people hate CPAP machines.
Yeah.
And they think that the CPAP is the only treatment for sleep apnea.
I call them sleep snorkels.
Sleep snorkels, yeah. People hate them. Oh, some people, I will say, some people love them because they're like, oh, I feel so much better.
Yeah, I can
when
actually sleep now,
Like,
yeah.
I have energy during the day. My mind is focused again. So some people do love them. But there's this perception that, I've heard people like never. There are other treatments for sleep apnea these days.
So there are bite blocks. Some people will go to an ENT and have surgery to open up airways. But there's also an Inspire procedure, which is like a little pacemaker for the muscles in the back of your throat. So that can be done as well.
So it just like opens up when it needs to?
Yeah, it takes a few months to get it perfect.
Oh, that's wild.
But it will actually get them to breathe at nighttime.
Yeah.
So is it almost like a TENS machine? Like it gets like nerve stimulation?
Yeah, it's actually implanted under the skin.
Oh, wow.
So it's not external, it's internal.
And for all you folks out there, I'm sorry to say this, no alcohol before bed.
Yeah.
That's the first thing you need to do if you've got sleep apnea.
Yeah. And weight loss helps.
Yeah, absolutely.
Alcohol in general is terrible for your sleep. And I know that everyone's like 1 glass of wine before bed. Actually, like alcohol has been proven to just disrupt your sleep cycle.
Oh, absolutely. And 1 glass of wine is the perfect dose to get the muscles in your throat to relax and exacerbate sleep apnea. So it's
The other
actually
thing-
the worst.
The other thing is a late meal.
Yeah.
Oh,
How many times have you eaten late and just twist and turn all night long?
Yeah.
So I usually tell people at least 3 hours before they go to sleep, they should not have a meal.
Put down the midnight cereal. That's my late night snack.
Midnight
is
cereal, oh,
Yeah.
yeah.
It's just so good.
Processed.
I know.
Processed.
I'm sorry.
Chia. Switch to chia.
I know. I need to go back to the chia seed pudding at night. alcohol in general, let's talk about alcohol and how that plays a factor with
Yeah.
testosterone.
Of course. Yeah, I mean, so historically, there's been sort of this idea that certain levels of alcohol consumption are safe, right? So I think historically it was sort of like suggested that maybe 1 serving of alcohol for women and 2 servings of alcohol for men was considered to be sort of okay. I think the evidence has emerged, and I'm sort of convinced by it, by and large, that there's really no safe level of alcohol consumption. Like any amount of alcohol can increase your risk of cancer, prostate cancer, lots of other cancers, etc. So that being said, alcohol consumption can have an impact on testosterone. I won't claim to be an expert on this, but my understanding is that for folks who consume a lot of alcohol, like alcohol abuse disorder type situation, it's not uncommon for their testosterone to be quite low. And another thing that happens, and Joe, maybe we can talk about this in more length, is body fat, even in men, has a role to play in terms of the relationship of testosterone to estrogen. So again, these hormones are not in isolation. They're sort of they're in a balancing act with other hormones that are in the system. And so the ratio of testosterone to estrogen in men can be relatively important for the impact that testosterone can have on long-term health. And so alcohol, I think, is relevant for both of those reasons for men.
I think it's also, with it being Movember, not just about prostate health or testicular health, it's also about men's mental health. And, I think alcohol is always a good topic to talk about with, mental health. If you are struggling with depression, anxiety, alcohol is not going to improve those things at all. It will actually make those symptoms much, much worse. So if you are struggling with any kind of mental health symptom, highly recommend seeking a therapist or a licensed psychologist to help you and avoid alcohol if possible. And that's coming from somebody who's 2 years sober. So just throwing that plug in there.
Hey, congratulations.
And I think the newer generation is getting it. Now that
Yeah.
they start doing dry January, now that they're starting to do non-alcoholic drinks, the sales of alcohol is actually down overall.
There's a largest spike in sobriety since the 1920s right now in the United States.
That's huge.
That's really great. I think from a supplemental standpoint, one of the things that you can also consider is stress. So we kind of talked about, maybe touched on this briefly earlier in terms of lifestyle, but what we do know is that stress can result in changes in hormone levels that are not actually optimum for testosterone levels. Like you can get elevated cortisol, you can get elevated epinephrine and norepinephrine. Those things kind of have a downward pressure on testosterone, or at least are disruptive to testosterone production. And so from a supplemental standpoint, if you happen to be in a position in your life where you're very stressed out and you don't have full control over changing those external circumstances to maybe lower the stress in your life, in addition to doing the things like breathing exercises and all those other things that can lower your stress levels, you can look to a class of botanicals that are traditionally referred to as adaptogens. So these are herbs that literally help your body adapt to the negative input of stress. There's a plethora of them that are on the market. One of my personal favorites is an herb called Schisandra. Schisandra has a lot of different benefits. It is adaptogenic, it's antioxidant, it has some liver support activity. I think there's some studies to show that it really helps with mental clarity and focus. So it's kind of one of those things that you can take it for stress, but it will have side benefits instead of side effects or bad effects, So you can look to this sort of group of botanicals called adaptogens to maybe help modulate your body's response to stress.
Mushrooms adaptogens? Yeah, I was gonna say everyone's talking about mushroom coffee and how that helps with stress. And I'm glad you brought up stress, because talking about men's mental health, stress is it's a domino effect. If you're very stressed, it's going to affect so many different things, not just your hormones. It'll affect your sleep, which also affects your hormones. It'll affect, your cortisol, your adrenaline. Like there's just so many negative health benefits, but then it also affects your mood. Stress increases depression, it decreases anxiety and other what they call comorbid conditions. So I think any kind of supplement that we can take to help reduce that stress. Everyone's on the mushroom coffee friends right now, and the cacao coffee. What do you feel about the functional mushrooms that can really help benefit all of those factors?
Yeah, from a traditional herbal standpoint, I'm not 100% sure that mushrooms would be classified as what is sort of grouped as an adaptogenic herb, just because I think they might be working via some different like mechanisms inside the body. That being said, mushrooms are wonderful for folks who do experience high levels of stress chronically. One of the things that comes along with that is immune suppression. You've got poor immune function. Well, mushrooms have absolutely been shown to beneficially modulate the immune system. There's a huge gut-brain axis problem where people who are under chronic stress can frequently have disruptions in their gut microbiota and gut functions. Mushrooms contain a lot of the sort of prebiotic fibers that are really helpful for gut health. So absolutely, even though I don't know that it would technically be classified as an adaptogen, those mushroom extracts have so many benefits. And if you can, coffee in and of itself is not unhealthy. That being said, if you're drinking a pot of it every day, that is probably too much caffeine. Replacing it with something that maybe is more of a caffeine-free energy boost, sort of calm energy type
And if you're
situation.
getting
Although
14
I will
pumps
be
of
doing a
hormone.
blog on coffee, and ideally 3 to 4 cups a day seems to be the right number of coffee a day to have the maximum antioxidant benefit.
Oh, I'm like killing it in the coffee department.
Yeah.
There's so many benefits. Although, to quote one of my professors at school, if you're using coffee as a vehicle for getting in more milk and sugar in your life, then it's not healthy for you.
Let's talk about the mushrooms for a second,
Please.
since that is a hot topic. Let's talk about fruiting body versus mycelium.
Oh, let's do that. It's a really interesting topic.
Yeah. So you want me to talk about?
Go for it.
So when you look at a mushroom, the top, what everyone considers the mushroom, is the fruiting body. The roots is the mycelium. Most of your bioactive beta-glucans are in a fruiting body. The mycelium are usually grown on oats or some kind of substance. In the United States, mushroom does not differentiate between fruiting body and mycelium. If you look at those bags that they grow the mushrooms, that you see all the little white lines, it's all mycelium. A lot of times that legally can be said as a mushroom. So they can take that bag, grind it up, and sell it to you as a mushroom. And you get a lot less benefit that way because now you have the oats, and the mycelium does not have all the beta glucans that the fruiting body does. So you have to make sure what kind of mushrooms you're getting. The other thing is mushrooms, like plants, have a cell wall that we can't digest called chitin. So unless you do something to break up that cell wall, that can go right through you and give you almost no benefit. So that's why a lot of times they'll use a hot water extract to break it apart from that cell wall to make it metabolically active.
Yeah, and from a traditional medicine standpoint, there is a reason. So, I mean, we owe a lot of what we currently understand about medicinal mushrooms to traditional Chinese medicine, to there's a traditional form of Japanese medicine called Kampo. There's various traditions around the world, and they historically have always used the fruiting body. They'll take the fruiting body, what we typically think of as being the mushroom, they'll dry it out, they'll slice it up, and then they'll use it in a tea or in a soup. So it's exactly what you're saying. It's a hot water extract that pulls out the active constituents, makes it bioavailable and useful. Yeah, it's a shame that it's maybe not as clear to consumers whether they're getting the fruiting body or a mycelial extract or something in between. Because from a company standpoint, it's less expensive and it's faster to use the mycelial extracts instead of the fruiting body. So it's really common to see that be where things are sourced instead of what's actually the best part of the mushroom.
So in summary, take your mushrooms in a supplement form and just
Drink
keep
your
drinking
coffee.
regular coffee because the mushroom coffee is gross anyway. Let's just be honest.
That's what that's how I live my life. And I eat them too because they're delicious.
But if you have 14 pumps of caramel syrup in your Starbucks coffee, you might want to pump the brakes on that.
Yes, it's no longer considered a health food.
All right. Well, before we wrap up today, I'm going to ask one more question. So we talked about so many different things today. What can men do? What types of supporting information or things can they bring to their doctor to be asking the right questions, to be getting the type of support that they need to be really improving their long-term wellness?
So I tell all my patients to get a journal because they may remember questions at home that the second they walk in the door, they forget. And then when they ask me the questions, take down some notes. Because again, you only remember 10% of what we say in the office if you're lucky. So they can refer back to them. Other thing they can do, bring someone to support them. That can take the notes for them, that can remind them of the questions. Men tend to be more stoic. So a lot of times I'll have the wife jabbing them in the side saying, but you do.
I do this.
Yes, yes. And that always leads us to a conversation that will then come up with something we can help with. But if we don't know, we can't help.
Right.
And I do think we're kind of in the midst of a little bit of a culture shift around that. That's sort of like the stoic persona of what a man is supposed to be, right? Like, I think there are some prominent voices out there and blogs and whatever who are what pretty much anyone would describe as being manly men who do embrace their masculinity, but are still talking about things related to health and well-being. You see recordings of ex-Navy SEALs who are talking about mental health. You see guys who are UFC fighters and this kind of thing talking about mental health, talking about health in general. So I'm sort of grateful that we're, I think, entering an era where maybe some of the stigma around talking about some of those things is kind of falling away. And so that's one of the things that I would suggest to men is find another man you can talk to who has maybe a similar experience. Like there are men supporting men support groups that are out there where you can just sort of talk to a guy who's gone through a similar experience. Maybe he's 6-12 months down the road from where you are and can give you some pointers and support and stuff like that. So there's sort of unfortunately, there's a little bit of an epidemic of social isolation for everyone, but for men in particular, where it's like you hear young guys, it's like, I don't even know how to make a male friend these days because, the environment's just different than it used to be. So seek a male friend, seek many of them, go golfing, go bowling, whatever the heck you want to do, and talk to them. I think some of the stigma about having those conversations has been removed. So
I think something else, talking about, the stigma around, men's health, there are so many other ways that men can support specifically their mental well-being. If you are nervous about, talking to someone, maybe start, with small low-hanging fruit, something that's very easy to implement that has been proven to boost your overall sense of happiness and reduce anxiety and reduce stress and depression is practicing gratitude. We're actually going to have a blog on this in November on our website about how to keep a gratitude journal or how to practice gratitude with a partner or a friend. And if you practice it consistently, has been shown to reduce depression and reduce anxiety. So, men out there, if you are struggling with those things, there are very small mindfulness activities that you can do that can help boost your mental health, especially in survivorship, going through cancer treatment or being in that watch and wait phase and kind of having that fear of the unknown, I think leaves this like looming cloud of doom over men's health. And it's very easy for your mind to kind of run rampant. So, other mindfulness activities, breathing exercises, grounding activities are really easy ways to get started for improving your mental wellness and taking those baby steps and then talking to another man or joining a support group or seeking a therapist. You have any comments on that, Dr. Joe?
No, I think men need to find common ground with other men, whether it's a hobby they like or women have done it so much better. And I think that's why women live longer. Men tend to get more isolated, and it's proven that men that are more isolated don't live as long. Cancer or not cancer, it's just isolation is not a good thing for a human being.
Right.
So fellas, you heard it here first. This is your excuse to go golfing with a buddy
Go
or
fishing.
start fishing, start a poker game, whatever it is.
And tell your wife it's for your mental health. Awesome. Well, thank you guys so much for this awesome conversation today. I really learned a lot, and I'm sure many of our listeners did as well. Do you have any final thoughts before we close off? Thank you guys for tuning in. Be sure to be on the lookout for one of our next episodes. We are going to be talking about refined sugars and all of the negative effects that come with that, especially related to cancer. Thank you both, Dr. Todd and Dr. Joe, for your time today and all of your just valuable insight and input into this conversation. And we'll see you guys next time.
Thank you.
See you next time.